Hello, my name is Camila Guevara.
Mi nombre es Alexandra Nava Gómez.
Hello, my name is Isabella, and we are going to present Alzheimer's disease.
The exact causes of Alzheimer disease are not fully understood, but at basic level, potential in the brain do not function normally, which disturbs the work of brain neurons and causes a series of toxic events. Neurons becomes damage, lost connections with each other, and eventually die. Scientists believe that in most cases Alzheimer's disease results from a combination of genetic, environmental, and lifestyle factors that affect the brain over time. Less than 1% of time, Alzheimer's disease occurs because of a specific genetic change that virtually guarantee that a person will develop the disease.
Alzheimer's disease is thought to be caused by the abnormal buildup of proteins, the amyloid deposits of which form plaques around brain cells. The other protein is called tau, deposits of which form tangles within brain cells. This process begins many years before the first symptoms, could be 10 years before, and affects the functioning and survival of the brain cells, interrupting communication between cells and causing their death. This process begins in the hippocampus. The hippocampus is crucial for memory and learning. That's why the first symptoms are related to memory loss and trouble with learning, and successively causes damage to other brain areas.
Patients with Alzheimer's disease have symptoms and signs of dementia. The most common first manifestation of Alzheimer's disease is short-term memory loss. Asking repetitive questions, frequently misplacing objects, or forgetting appointments. Other cognitive diseases tend to affect multiple functions, such as the following: impaired reason, difficulty handling complex tasks, and poor judgment, language dysfunction, difficulty thinking of common words, errors in speaking and or writing, visual-spatial dysfunction, inability to recognize face or common objects.
The course of the disease follows some stages. The first is inexistent, and there are no visible symptoms. The second stage is very slight. There, the person starts to forget names and where they left their belongings. They also don't appear to have any trouble when they are examined. At the third stage, that is called slight, there are some alterations in one of the following areas. First, getting lost in unfamiliar places. Second, loss of performance. And third, problems at evocating words and names. If they are evaluated, the problems are evident. At the fourth stage, that is called moderate, there are some obvious defects in clinical interviews. For example, remembering events, at concentration, at planning events, and at complex tasks. There is preserved orientation in time and person. They have also memory of names, familiar faces, and movement in familiar places. At the fifth stage, that is called moderately severe, there is no recollection of current relevant data, for example, telephone numbers and directions. They also might have difficulties at self-care. At sixth stage, that is called severe, they might forget their loved ones' names and can't do reverse counting. They also need help for daily activities and for making certain movements. And also, they have emotional and personality changes. The seventh stage is called very serious. It has a progressive loss of verbal and motor capacities. They also have urinary incontinence, and they need constant assistance at self-care, including feeding.
Treatment. Alzheimer's disease is not curable, but the symptoms can be managed by pharmacological treatment. Most of the medicine work best in people in the earlier middle stages, but the medication may eventually lose their effect as the disease advances. There are also some non-pharmacological interventions that aim to delay the loss of mental abilities, including memory and orientation exercises. The intervention depends on different things, like the person's symptoms and how far the disease has progressed. It's important to make sure that interventions don't demand too much of the person and aren't stressful. Some of those therapeutic strategies are cognitive therapy, physical, emotional, and social stimulation. Physical activity has health benefits for people with Alzheimer, improving strength, endurance, and balance. Social stimulation improves quality of life and can help prevent the Alzheimer related apathy. Emotion oriented interventions. The aim is to make people with Alzheimer to feel understood, focusing on the feelings, values, and experience of them. And diet. Some expert believes that eating a healthy diet helps to slow down Alzheimer.